I welcome you to the second lesson of this video course on this book, Positive Health, Health Beyond Pills. This is a book that talks about holistic health. It teaches you how to think, pursue, and live holistic health. In this second lesson, we are talking about some concepts that border on well-being. So we are looking at what is referred to as salutogenesis, which is the origin of health, and pathogenesis, which is the origin of disease. There are people that when they think about health, they think about health more in a negative sense. So they think about health in terms of disease, illness, something bad happening to you, accident, taking medication, going for surgery, and so on. So that's a more negative definition of health. And this idea of negative approach to thinking about health is supported by the concept of health referred to as pathogenesis. Pathogenesis is looking at the origin of disease. So it means that you need to find a problem to understand the cause of the problem. So pathogenesis is more like trying to understand the risk factors of a disease, the causes of diseases. It means you have to wait for a disease to happen, for a problem to happen, for an illness to happen. Then you want to find out what is the cause of this particular illness. For instance, if somebody has a stroke, then you want to find out what are the risk factors of the stroke, what are the causes of the stroke. Of course, with research, now we know the risk factors and the causes of many diseases, okay? The origin of the many diseases, all right? So that is what we call pathogenesis, trying to understand the origin of disease. Now, on the flip side, we have what we call salutogenesis, that is looking at the origin of health. The approach salutogenesis adopts is to look at what is right with people, that when they focus on improving, they can live longer, healthier, and happier. In other words, salutogenesis is looking at health assets that people have that when they improve. These health assets or these health factors, or what we call salutary factors, can be biological, material, social, psychological, financial, anything that can help a person live longer, live healthier, live happier, and then encourage people to adopt these factors. That is salutogenesis, all right? So it creates that environment for people to be exposed more to these salutary factors or these health factors or these health assets so that they can rather improve on their health. Now, when we talk about blue zones, we are referring to some areas or some regions of the world where people live longer, healthier, and happier. So with a more positive approach to health, a person wants to go and find out what are the characteristics of these people that live longer, healthier, and happier. And what is it about their environment, about their lifestyle? Okay, that is salutogenesis. A focus more on a positive definition of health and looking at what we call salutary factors or factors that can improve people's well-being. Okay, I should say that both concepts are complementary. So you don't just think about origin of health without delving into the origin of disease. So pathogenesis, salutogenesis are complementary in order for us to achieve well-being. But the lesson here is that we don't just think about health in terms of the negative aspect, disease, illness, and so on. We can also think about health in terms of what is right with people that when they focus on, they can achieve well-being, happiness, and live longer.